All right, hello and welcome to today's webinar on medical review findings in transportation of portable x-rays. My name is Mary Sue Gardner and I'm a registered nurse on the Provider Outreach and Education Department. Portable x-ray suppliers provide diagnostic image services at patients' locations, most often residences, and that includes private home and group living facilities such as nursing homes, rather than in a traditional clinical setting such as a doctor's office or a hospital. Medicare generally reimburses for portable x-ray services if the conditions of coverage are met. So in today's webinar, we're going to focus on those conditions as well as the medical review findings when they're reviewing for this service. Now, on the screen, as well as in your slide deck, is our disclaimer. And our disclaimer basically says we created this as a tool to assist you, but the Medicare rules often change. If they change, it's your responsibility as a provider to make sure you are following the most current laws, rules, and regulations that are in place on the date of service you are providing your services. It also tells you that we're going to respond to questions based on laws, rules, and regulations as they are today. So if they change, again, tomorrow, CMS rules will determine final coverage on those. Finally, CMS prohibits the recording of this presentation for profit-making purposes, and that includes screenshots. So we ask that you not make any screenshots of this. We are recording this for you, and it will be on our YouTube page and Encore page as an encore of this event within the next 15 business days. This is just a list of acronyms that I may or may not say during the course of this webinar. So if I happen to use an acronym that you're not familiar with, please just refer back to this. If you can't find it or it's not listed on here, and I happen to use an acronym because we all know Medicare is like acronym soup and there's an acronym for everything, just type it into the chat and Jennifer or one of my other associates will answer that question for you. All right. My objective for today is that you learn about the documentation requirements for transportation of portable x-rays and learn about this in an effort to avoid denial of services. So the agenda part, we're going to discuss the coverage criteria and limitations of this service. We're also going to review the required documentation. And we're going to present some medical review findings and discuss medical review findings and how you can avoid those. HCPCS R0070 is the code for the transportation of portable x-ray equipment and personnel to perform the x-ray at the patient's home or at the nursing facility. It is to be used when only one patient is seen. So this means that the equipment must be transported there and it cannot be housed there, and it can be used for one patient when you're using the R0070. And that happens to be the HCPCS code that we have under review currently. So again, HCPCS code R0070 defines only one patient being seen. Thus, there should be no modifiers indicating multiple patients were seen. And that includes modifiers like the UN, UP, UQ, UR, and US. If more than one patient is being x-rayed, then the HCPCS code R0075 should be used instead. And again, this edit right now that we are talking about is only for the use of HCPCS code R0070. So that's a little bit of background information on the code. Currently, We're reviewing this service because data analysis indicated potential aberrancies related to the transportation of the portable X-ray equipment. So again, our goal today is to help you understand the coverage criteria and the documentation requirements to avoid receiving a denial upon review. So what does Medicare cover for portable X-ray services? Well, as you can see on this slide, Medicare will cover the following: skeletal films involving extremities, pelvis, vertebral column, or the skull; chest films or chest X-rays, which do not involve the use of contrast media, except for routine screening procedures and tests in connection with routine physical examinations. It also covers abdominal films, which do not involve the use of contrast media, and diagnostic mammograms. So during our reviews, we're not looking at like the diagnostic mammograms, the certification requirements when it comes to those mammograms. But there are rules and regulations regarding that you should be aware of that are in 42 CFR Part 486, Subpart capital C. So our analysts will confirm the CPT code billed and the body part X-rayed and make sure that those are appropriate to be covered for this service. So things that aren't covered for the transportation of portable X-ray. Areas include the ribs and the facial bones, like the mandibles and orbits and sinuses, and even soft neck tissue. This does not mean these types of X-rays are not covered. It means that they are not covered under the transportation of portable X-ray benefits. So let's talk about some additional limitations. Under transportation of portable X-rays, there are also other limitations for Medicare. So procedures and examinations which are not covered under the portable X-ray provision include procedures that involve fluoroscopy, procedures involving the use of contrast media, procedures that require the administration of a substance to the patient or an injection of a substance into the patient, and even special manipulation of the patient. So as we continue on, additional limitations include procedures which require special medical skills or knowledge possessed by a doctor of medicine or doctor of osteopathy, or which require medical judgment to be exercised. This would be such as services like an interventional radiologist would perform that are going to complete a procedure like a needle biopsy based on what they're seeing at the time. Also, under the limitations, procedures that require special technical competency and or special equipment or materials, routine screening procedures, and procedures which are not of diagnostic nature. So basically, we will auto-deny X-rays that are routine X-rays that are not diagnostic in nature. We'll also auto-deny procedures that involve fluoroscopy or procedures that involve use of contrast media, etc. So if they are listed as a limitation and you try to build them under the transportation of portable X-ray service, they may automatically be denied because they don't fit the requirement in the category. All right, so let's then talk about some documentation requirements. When it comes to documentation requirements for the transportation of the portable X-ray, the documentation that must be present includes a signed provider order, or we can take intent to order the portable X-ray. And that has to include which body part is to be x-rayed. And we're going to talk about that physician order in just a little bit here as well and expand a little bit on it. History, physical, and or progress notes should be included that indicate the patient's condition that is warranting an x-ray to ensure that that x-ray is diagnostic in nature and it's not routine. Statements by the provider to display why the patient can't have an x-ray at an outside facility like a clinic or a hospital. So some examples of this, and this is not all inclusive, but some examples include like the patient is bedbound, or the patient is non-ambulatory, or they're a fall risk, or based on mental or physical disabilities, they cannot get to, you know, like an outpatient facility. And again, that's not all-inclusive list. WPS really expects that the reasoning makes sense clinically so we can consider it for coverage. Also to include in your documentation is the report. So documentation for the date of service under review to give us a description of the x-ray performed and to confirm the transportation was done to that specific location. And so that's the report that really says this company is going to this location, bringing this equipment to x-ray one patient for this type of x-ray, chest x-ray, let's say, for example. X-ray results. So x-ray results can be included, but they're not mandatory in the review, but they're very helpful, especially if you're doing follow-ups from prior x-rays. And then finally, an advanced beneficiary notice of non-coverage if it's applicable. So if you completed one, we do want you to submit that. As we move on and we start to discuss the physician order, and at the start of this presentation, I stated that, you know, the physician order is a necessary piece of documentation. So I just want to talk about that a bit more. To satisfy the physician order information, we would need a signed order or requisition from the provider. If there's an unsigned order or requisition and the medical records that are also submitted support the intent to order the service, we can then consider that for coverage. So again, if we don't have that signed order or requisition, we are going to look to the rest of the documentation that you supply, and we need to see the information that documented by the physician, generally in their progress notes, that it was their intent that XYZ type of x-ray be performed for XYZ diagnostic condition. An intent to order refers to documentation that reflects that provider's plan to order a portable x-ray. So think of it that way. You know, if we have to rely on intent, we're going to look for that provider's plan. And it also helps to support medical necessity. Again, we would need the authenticated medical record that supports this intent, because without that information, if we have no signed order and we have no signed documentation that helps support the intent, we cannot in good faith say that this was provided under physician direction. We can also accept a telephone order for services. If a telephone order is the method used, there must be documentation of the phone call in both the medical record at the provider's office, and the testing facility needs to have that on file as well. So there is IOM definitions for orders for testing facilities and treating physicians, et cetera, and that can be found in the internet-only manual. 100-02, so the Benefit Policy Manual, Chapter 15, Section 80.6.1. All right, the order must meet, again, requirements and include a statement concerning the conditions of the patient, again, which indicates why the portable X-ray services are necessary. So as we move on, the final piece of documentation that needs to be included, the thing that we're looking for is the portable X-ray report. And we kind of touched on this briefly. And we're not looking specifically that this is the review of the X-ray by the radiologist, but the report that is kept by the transportation facility that contains the following information. So it's the report that has the date the X-ray was performed, and it also has who's doing it as well as the location where the beneficiary is. We need to see information that portable X-ray equipment was transported, just so we can verify that it's not stored on site and just being used there. And then the number of beneficiaries that are included. Because remember, if you're going to bill the R0070 HCPCS code, that is only for one beneficiary. So we do need to see that that documentation, again, supports that it was only one beneficiary being seen at that location. All right. So as we move on, we're going to start talking about some review findings. Some of the things that medical review is finding when they're doing review of this service that is causing claims to be denied. All right. Oops. There we go. All right, so the first medical review issue is lack of documentation to support that the equipment was transported to the location. So again, that goes back to that review or the portable X-ray report. A transportation charge is not payable unless that portable X-ray equipment used was actually transported to the location where the X-ray was taken. For example, MACs did not allow a transportation charge when that X-ray equipment is stored in the nursing home for needed use. So if the documentation from the billing entity doesn't support that that was actually transported, we can't, again, in good faith, say that it fell under the transportation benefit and allowed for those services. All right. The next issue that medical review has seen is the lack of documentation to support that the X-ray was diagnostic in nature. So as far as denial trends go, the top reason for denial is generally lack of documentation from the ordering provider to support that the X-ray was diagnostic. For example, what was the provider attempting to diagnose? Or what did the provider suspect to be the origin or cause of the presenting symptoms? So documenting symptoms alone, such as shortness of breath or cough or diminished breath sounds or dyspnea, that's not sufficient to fulfill this requirement. What we need is what the suspected diagnosis is, or what it is that they're looking for to diagnose. Are they looking at a chest X-ray to see if there's continued pneumonia from prior X-rays, to see if there's continued infiltrates? whatever the case may be that they're looking for, that's what we need to see, not symptomology alone, but the actual what they're trying to diagnose, what they're trying to rule out. All right. Next is lack of documentation to support the necessary physician involvement. So we've already said several times, the documentation must contain the physician order for the service. There must be documentation by the physician that's treating the actual patient and going to use the results in the overall treatment of the patient. So the physician, again, must note the specific medical problem and the results that they get from the x-rays. They need to use those results in the management of the patient's medical problem. So, and this goes beyond documentation for the transportation benefit, but goes into the office documentation, and something to keep in mind. When you order any kind of diagnostic imaging or run any kind of diagnostic tests, there is an expectation that you will use those results in the management of your patient. So your documentation needs to support how you use those results. If there is continued lung issues that necessitated the chest x-ray and we see continuing fluid or pneumonia in the lungs, and the doctor decides to continue IV antibiotics for that or oral antibiotics, then we see how it was used. If the same person's x-ray is now clear, then you're using the results to say we can discontinue the antibiotics, we can discontinue the breathing protocols, et cetera. So again, your documentation should relate back, and that is not necessarily specific for this transportation of portable x-ray benefit, but consider that in all aspects of your documentation. If you order a test for diagnostic purposes, then document how it's going to be used in the management of the patient. All right. Next issue is lack of documentation of portable x-ray reports. So we talked about the report and that suppliers should create some type of report that is a record of each patient's service, the date of the portable x-ray examination, the name of the patient, description of procedures ordered and performed. It has the information about the referring physician or non-physician practitioner if allowable by state, the operator of the portable x-ray equipment, so who performed that examination, as well as the physician to whom the radiograph was sent and the day it was sent. Such reports need to be maintained for a period of at least 2 years or for a period of time required by state law or state records. So make sure you keep that in accordance with Medicare standards and state standards, and whichever is longer is how long you need to keep those for. So in the 42 CFR, section 424.5, it states the provider, supplier, or beneficiary, as appropriate, must furnish to the MAC, it says intermediary or carrier, which we're now MACs, sufficient amount of information to determine whether payment is due and the amount of payment. The patient's medical records should contain enough information to substantiate the claim submitted to Medicare. For portable x-ray services, that includes the documentation outlined in this that I gave you in this presentation. So you can find that information in that section of the 42 CFR as well. So if that required information is missing in the submitted medical record, the claim will be considered invalid, and steps will be taken to recover any Medicare funds that were already paid out to you. All right, so this slide is just some resources that give you some additional information about where you can find information on the portable X-ray services. Now, I am going to bring over some actual documentation that we have looked at and to kind of show you why this may or may not pass upon medical review. Jennifer, can you verify that you are seeing a PDF on with the information on a claim?
Yes, I am.
Perfect. Thank you so much. Okay, so in this documentation that we have before you, we have patient demographic information and we have details about the service. They wanted an X-ray, they needed it stat, they needed it for dyspnea, unspecified. They are coding the R0070 and only one patient is being seen. So let's think about some of that information that we talked about being necessary. Location. So we need to know who the patient is and where they're going. And that information was contained in here. And we have a facility address and we have demographic information on the patient. So I'm going to just scroll back up. We have information that I didn't include from the transportation portable X-ray company, that we could see that their equipment was being transported. We know in this case that the X-ray to be performed, that they wanted a chest X-ray, and that is one of the types of X-rays that is covered. So we know we have some of those things covered right away. So other things we know we need, order or intent to order. So as we look through here, we did have, and I have to sanitize things out, but we did have an order for the chest X-ray, and it was signed by a PA. And so that information is all in here, and it tells us that this X-ray is for dyspnea or shortness of breath. There are no additional documentation on this order to give us any indication of the reason for the diagnostic, not on this order anyway. Okay, so we do need information that supports the medical necessity of the service, and things like statement or a note from the ordering provider, the reason the X-ray needs to be done portably, etc. And in this documentation, we do have a statement here that the patient is homebound and requires someone's help to leave their place of residence. Leaving the home requires considerable and taxing effort for the patient. So we have some justification here as to why it needs to be done portably. Again, one transportation, one patient, they're going to do 2 images. And then we have the X-ray results, and we have some findings here. What we don't have is what the provider is looking for. What supports this diagnostic X-ray to be performed? So we have symptomology listed, but what are they looking for? We know we have shortness of breath. We know that it gets worse with exertion, but what are they trying to diagnose? What are they trying to rule out, etc.? So in this, we did not receive any documentation that supports what they are looking for. Now, we do have findings that, say there's no focal infiltrates. We have some cardiopulmonary disease and some osteoarthritis, but we don't know if that is or is not what they were looking for. We only know that the patient had symptomology and that it was dyspnea. So if this was the only documentation that we received for this patient, for this service, for the R0070, this probably would not be considered for coverage. Now, this is just one example. And again, I have to redact and sanitize out documentation. So if it came, additional information came in on appeal, et cetera, and I don't have that here, I wouldn't know that right now, but on initial review, how this stands, this probably would not be considered for coverage. So let's go ahead and look at another example. And let me scroll way up. So in this example, again, this is just the order form that was received for the patient. We know it's a male. We know there's going to be a chest x-ray. We have chest x-ray with 2 views. And again, this one is for dyspnea of this patient. So again, we have symptomology listed here in the order form. All right, conditions that require the exam to be performed portably is that the patient is weak and non-ambulatory. So this is information from the transportation x-ray company. We had tech information. We had number of images. We knew that there was one patient. And they also included their log. So their log included, who the patient was and who the various patients were that they have gone to on that day and how many x-rays were performed. And this did support that this company was going for only one patient on that day, and they were to perform 2 x-rays of that patient, 2 chest x-ray, 2 view x-ray. All right, so then we get the results of the radiology report. So we still see some patchy, modest, oh my goodness, I can't speak today, bilateral airspace disease, pneumonia should be considered. So as we scroll down, again, now here we get to the information from the provider, from the ordering provider. We know that we have a diagnosis of dyspnea on exertion. We know that this patient is homebound due to some impaired vision, as well as muscle weakness and fatigue. We have it dated on what date they want this. And then there's a few pieces of documentation that I took out because they really didn't make a difference for this review. That was just some medications, in their review of system and H&P. So as we get to the history of present illness part of their H&P, we can see that this person was seen in their home for follow-up of a recent acute illness, specifically pneumonia. The oxygen levels have continued to dip. They haven't been able to get oxygen for him. Feels like his dyspnea or shortness of breath with exertion has improved slightly. So we have information about symptomology here. And then we have some information on what they're actually seeing or hearing with the patient. So we still have some rhonchi and some wet rales and crackles. There's some better air movement, no wheezing. Lung sounds are improved. So then when we get down here, we know that the patient has dyspnea on exertion. They're going to do some oxygen tests soon and pursue that home O2. They're going to repeat the chest x-ray, and this was the information just prior to this chest x-ray. We'll repeat chest x-ray if there is residual infiltrate. Will continue the antibiotic course. So now we know what they're looking for. They're looking to see if there's any residual infiltrates left, and if there are, they're going to continue to give this patient the antibiotics. And again, I took out the rest of the information that was not pertinent. So we have the information that we needed in this chart. We have the order and intent. We have history and physical or progress notes that supported that portable x-ray was necessary, and a statement that indicates why it needs to be portable. We have portable x-ray services that supported the date of service they performed it on, the location. We knew that the equipment was transported to the site. We had a covered x-ray type, and most of all, we have documentation that supports why this diagnostic x-ray needs to be performed. All right, so with that, whoops, got my cart before my horse a little. I am going to move on in the presentation, and we're going to kind of follow up. Again, if you downloaded a copy of the presentation, this page that you're seeing now is just the resources. If you want to go back, and obtain those additional resources on your own. It's always a good idea to go look and see what CMS and WPS have listed, especially when it comes to documentation requirements. If you are documenting to, meet all the requirements listed in the laws, rules, and regulations, then you're probably always going to meet the mark if it comes to medical review of your services. All right. I just want to let you know, and if you've been in any of our recent teleconference or webinars lately, you've seen this slide, but there is still time for you to register for a national in-person provider enrollment conference, and that is actually sponsored by CMS in conjunction with Noridian Health Solutions, and that is in San Diego, California. So not only is this the largest provider enrollment conference in the country, it's also absolutely free for you to attend. So if you have the information, if you downloaded our slide deck, you can actually click right here and it will take you to the description and registration. And we also have this information available on our website as well for you. So at this time, I am going to pause and ask Jennifer if there have been any questions that have come into the chat that have not already been answered. Jennifer?
There's no questions in the chat right now.
All right, thank you. That doesn't mean you don't still have time. So if you have a question, go ahead and throw that into the chat, and I will pause one more time before we conclude the event. And I'm just going to take a quick look at the chat, and I do not see anything that's come in. So on behalf of myself and Jennifer, as well as Medical Review, we want to thank you for your participation in today's event. This concludes our webinar, and you may now disconnect.